All this is Dr. Mubin Sayed from DrBeen.com. My apologies for the cough. So we're going to be looking at how Sigrid says why back-to-back lectures. This study was interesting and important, I think, for women to know this one and their physicians to know and their families to know. So now, very quickly, how does the ACE2 enzyme help or not help? So what happens is, let's say we have a blood vessel. The blood vessel innermost layer is endothelial cells, right? So the inner surface cells. So I'm going to make one endothelial cell over here, one large one, just for as a prototype cell for us to kind of look at. The endothelial cells are then, so let's make one more over here. Outside of these cells, depending upon the type of blood vessel, how thick it is, etc., but I'm just going to make it all the way thick. Then there are actually smooth muscles. There are muscles that kind of encircle the blood vessel like a little cuff. And their job, when these muscles contract, they cause the blood vessels to become, uh, blood vessel diameter to reduce. So shrinking the blood vessel size or dilating the blood vessel lumen diameter is the job of these smooth muscles. So now how do these smooth muscles actually relax or contract to increase or reduce, to relax to increase the diameter or to contract to reduce the diameter? What happens is that the endothelial cells produce nitric oxide. That nitric oxide goes outside of the cell and to the blood, to the smooth muscle that is outside, and it helps the smooth muscle relax. So endothelial cell is very important for the smooth muscle cell of the blood vessel to contract or to relax. Now the endothelial cell has ACE2 enzyme on it, ACE2. So we have to understand, why is a blood vessel why does a blood vessel have, or blood endothelial cell have ACE2 enzymes on it? So that is a very, very interesting mechanism. If you wanted to read that in detail, that will be renin angiotensin aldosterone system, or something called renin angiotensin aldosterone system, ROS. Very, very big system. I think I did on DrBeen.com. My lectures are present discussing this system, and I think I did like 6 or 7 lectures explaining this mechanism. So for me to try to explain that in 10-15 minutes is kind of beyond the scope of this one. But let's try to understand what is going on. What happens is that so let's say this is our heart, and this is a closed circulatory system, or our blood vessels. This is the heart. Our body's need changes to increase the blood flow and pressure, or to reduce the blood flow and pressure, sometimes to one viscera or one organ to versus another, and so on. I just made one big blood vessel here. To change the diameter, we use something called renin. So what happens is, the liver makes a protein called angiotensinogen. It's a pre-protein. It's a protein. This protein is circulating in our blood circulation. When we need to change the blood vessel diameter, our kidneys will release something called renin. Now, you could say, why would the kidneys do that? Excuse me. Reason for that is very simple. Kidneys receive a lot of blood flow from each what is that from each heartbeat, and the blood that comes arrives in the kidneys would then have to filter that blood, make urine out of it, throw the waste product out, and keep the good things back. So kidneys not only know the blood flow that is happening to them, the blood pressure that is present in the body, but also the electrolytes and the waste products. They know everything. So because kidneys know the status of blood pressure, blood flow, and chemical status of the blood, kidneys are in the best position to tell us when to increase the blood pressure or not. So when kidneys feel that we have less blood flow and pressure coming towards kidney, and if it reduces further, this patient's kidneys would become damaged, or the brain would damage, or something else, they start releasing renin. Renin would work on the angiotensinogen and convert that into angiotensin. This protein, angiotensin, passes through our blood vessels. So this is also circulating in the blood vessels. And there is an enzyme called ACE, angiotensin converting enzyme. Remember, the ACE2 enzyme became more popular with COVID. That is ACE2. There is also another enzyme called ACE. Let's call it ACE1 just for comparison's sake, but ACE, angiotensin converting enzyme. So that enzyme, ACE enzyme, is present abundantly in the blood vessels of the lung. So let's say these are the lungs. The blood vessels that are passing through the lungs, these blood vessels, endothelial cells, have abundant amount of ACE enzyme on them. The ACE enzyme works on angiotensin and converts that into angiotensin 2. They work on angiotensin 1, and then that becomes angiotensin 2. Now this angiotensin 2 is an important enzyme. What it does is it causes vasoconstriction. It works on the smooth muscles of the blood vessels. It causes vasoconstriction. That means it increases blood pressure. It is pro-inflammatory. When angiotensin 2 binds with its receptors, which are called angiotensin 1 and 81 and 82 receptors, mostly 81 receptors are the one that are used. 81, angiotensin 2 receptor type 1, when 81 receptors are activated by angiotensin 2, pro-inflammatory pathways become activated in the cells. Fibrosis happens, proliferation happens, vasoconstriction happens. All of this increases the blood pressure and increases and increases inflammation. NADPH oxidase becomes activated, which causes reactive oxygen species production. So you can think of angiotensin 2 as a molecule that causes vasoconstriction, that means increases blood pressure, plus it causes inflammation. So to an extent, it is fine to have, but if it is more than normal, it is going to cause a lot of inflammation throughout the body. So what do we do with this angiotensin 2? We are making it all the time. How do we neutralize this? How do we destroy this so that it doesn't continue to increase our blood pressure and continue to cause inflammation? So what we do is we have ACE2 enzyme. ACE2 enzyme takes the angiotensin 2 and further modifies it to something called angiotensin 1 to 7. And you might say, what the heck is this name, angiotensin 1 to 7? So what is happening is that the original molecule, angiotensinogen, that was made by liver, that has about 60 molecules. This 1 to 7 is actually the number of molecules, number of amino acids left after all the trimming of this molecule. So remember, angiotensinogen was converted into angiotensin 1, and then angiotensin 1 was converted into angiotensin 2, and then angiotensin 2 by ACE2 enzyme is converted to angiotensin 1 to 7. So only 7 amino acids are left. This 60 amino acid molecule has become trimmed and shaved down to 7. That's why called angiotensin 1 to 7. Now, angiotensin 1 to 7 has its own receptors called MAS receptors, MAS, MAS receptors. When angiotensin 1 to 7 binds on the MAS receptors, it does everything opposite to angiotensin 2. If angiotensin 2 was vasoconstrictor, then angiotensin 1 to 7, when it binds with the MAS receptor, it is a vasodilator. If angiotensin 2 was pro-inflammatory, then angiotensin 1 to 7 is anti-inflammatory. If angiotensin 2 was pro-proliferation, that is increase in number of cells, then angiotensin 1 to 7 is anti-proliferation. If angiotensin 2 is pro-fibrosis, fibrosis is like scarring of the tissues, and fibrosis is a big problem. If we start having fibrosis in various tissues, the tissue is replaced by scar, and that can actually destroy the tissue and kill the person. Angiotensin 2 is pro-fibrosis. Angiotensin 1 to 7 is anti-fibrosis. So, because angiotensin 1 to 7 is formed by ACE2 by converting angiotensin 2 into 1 to 7, there is always a balance. So, there is ACE2 always sitting there on the endothelial cells, always picking up angiotensin 2 and converting a part of it to angiotensin 1 to 7. So, there is always a balance between the angiotensin 2 and angiotensin 1 to 7. Good. That is balance that is happening in you right now. You are making angiotensin, you are making renin, you are making angiotensin 2. Then your angiotensin 2 is being converted by ACE enzyme on the endothelial cell into angiotensin 1 to 7. Mickey says you have a new gaming chair. Actually, this was the chair in my other office. It is my son's chair. And then what happened was I started sitting in the other office more when I was doing the book diagrams, and that chair was really bothering me. This chair over there was bothering me. So I took my more comfortable chair over there because I was spending more time in that office, and I brought that one over here. So this is why it is here now. So, so does this make sense? This diagram is the heart of our health. Angiotensin 2 and angiotensin 1 to 7. This is pro-inflammatory. And this is anti-inflammatory. And if I asked you, inflammatory, if I asked you, where does angiotensin 1 to 7 come from? The good one, the anti-inflammatory one. It comes from angiotensin 2. It comes from the bad one. And who makes it? ACE2. So you can imagine how important ACE2 is, right? That is the one that is creating the balance. Now think about it for a second. If we occupy the ACE2 by something else, if we make this guy unavailable, what will happen? Think about it for a second. Let's make it unavailable. It's not available. Who is available now? Angiotensin 2? Because angiotensin 2 is made before the ACE2 works. What will angiotensin 2 do? It will work with the AT1 and receptors and AT2 receptors and cause inflammation and fibrosis and proliferation and all of those kind of things, bad things. Vasoconstriction increases the blood pressure, increases glucose levels, causes diabetes, etc. But the ACE2, who we were banking on to say, hey man, hey good man ACE2, why don't you pick up this bad thing angiotensin 2 and please neutralize it into a good thing? But it turns out angiotensin 2 is not available. So now we have two problems. On one end, the bad molecule is increasing because it is continuously being produced by the liver and the angiotensinogen, and then renin system is present and it is being converted into angiotensin 2 and it is just increasing. That is one problem. The second problem is its counterpart, the one that stops its action or counters its action, is actually reduced. New is not forming, old one is used up and gone. So we have a huge problem. Our body status becomes pro-inflammatory status. We become hypertensive as well. This pro-inflammatory status is going to cause endothelial damage. How? Remember, these ACE2 are present on the endothelial cells. So if we go back to the blood vessel again, we make an endothelial cell, has an ACE2 enzyme on it, and imagine spike protein came and bound here from the virus or the vaccine, wherever it came from. Marsha says looking for Luffy. Luffy actually went out about an hour ago. So JLB says, so how to update ivermectin in this situation? So ivermectin is actually something that can interfere with the spike protein, at least from the studies that I have read. And if that is the case, then this ACE2 destruction can be reduced by ivermectin. So Heather says, is it because of the spike shedding from those who have been vaxxed? So there is no proof of spike shedding. So I don't think it is the spike shedding from those who are vaxxed, but those who are vaccinated may have spike in them, some of them, not all of them. And similarly, those who are infected may have spike in them as well. Some of them, not all of them. So now we have the spike protein in here. When the spike binds with the ACE2, we have a few problems that will occur. Number one, think about it logically. Is this ACE2 available for angiotensin 2 anymore? No. Why? Because it is bound to spike protein. So this is a useless enzyme now. So one angiotensin 2 is now going to be increased, or one or many. Why? Because this enzyme was going to cut them, and this enzyme is occupied by the spike protein. First effect. Second effect, when the spike protein binds with the ACE2, it causes the ACE2 to become downregulated. Downregulated means that the complex of spike protein and the ACE2 is brought back into the cell and digested and broken away. So now think what's going to happen. We have abundant amount of ACE2. They are bound to abundant amount of spike proteins. And now all of a sudden, all of those are gone from the surface. Why? Because they got downregulated. So downregulation occurred. Second problem, again, what is the issue with that one? Once again, angiotensin 2 that was sitting here waiting to be cut into angiotensin 1 to 7 is now just abundantly present and accumulating and increasing, and it's going to keep causing inflammation and vasoconstriction and so on. Then what else will happen? This is where, so this is the endothelial cell. When ACE2 is occupied by spike protein, there is a effect, there is an activity of the ACE2 enzyme, which is not just the cutting of the angiotensin 2 into angiotensin 1 to 7. Instead, inside the cell, there is an activity that causes various inflammatory pathways to become activated. Inflammatory pathways are activated. So this cell becomes inflamed. Not only that, the reactive oxygen species that are being produced, endothelial cells make a bunch of reactive oxygen species and nitrogenous species. Then those endothelial cells try to neutralize them as well by superoxide dismutase and other antioxidants. When the spike protein is present on the ACE2, spike proteins in the ACE2's internal behavior is to reduce the production of superoxide dismutase or antioxidants. So what will happen? This endothelial cell is going to produce a lot of reactive oxygen species and nitrogenous species that are going to make this cell inflamed, plus these species are going to leak out of the cell. Then as they go towards the muscle underneath, the muscle becomes inflamed. When they come out in the blood circulation, platelets become activated and we got clotting. So now we've got an inflamed blood vessel. Now we have gotten platelet that are clotting. So blood clotting is happening. Now we've gotten a vascular vasoconstriction. We are getting smooth muscle damage as well. Sally says, what about nicotine to reduce inflammation? Yes, that is nicotine has shown its effect as well. So Anthony says, can the wax cause atherosclerosis? I had this in my median artery with no palpable pulse in the wrist. No other arteries had issues and cause unknown by surgeon. So if it is just one artery, usually that must be a local problem, because these kind of pathologies, they become widespread everywhere. But can the vaccine and the other, so the study I just discussed a few minutes ago, that study said that the COVID's presence would cause blood vessel stiffening in women, not in men, by 5 years, even if it is mild COVID. And if it is they are vaccinated, then it is almost half. So instead of 5 years, 2.5 years or 3 years. So it seems like from that study's point of view, vaccine was actually protective for women, not men. Men had no effect. So could the vaccine separately cause the spike protein itself could cause things, and that is the mechanism that we are seeing here. Okay, so what is the result of all of this? Number one, increase angiotensin 2. Number two, reduce superoxide dismutases or antioxidants. Number three, increased inflammatory pathway activity. The result, blood vessels are inflamed, clotting is happening, vessels are constricted. The more constricted the blood vessels are, the harder they are impacted by the blood flowing through them. That causes even more damage. So this is just a few. You know that I've done 1,200 videos on this topic. So this is just some. So look at this. SARS-CoV-2 spike protein induces endothelial inflammation via ACE2 independently of viral replication. So meaning spike protein can cause inflammation using ACE2, but it doesn't need the virus itself to be replicating. So this is one study that is interesting. Here is another. SARS-CoV-2 spike protein impairs endothelial function via downregulation of ACE2, which I just discussed, which causes then angiotensin 2 to increase and angiotensin 1 to 7 to reduce. Then here, SARS-CoV-2 and the spike protein in endotheliopathy. So these are just a few. I have been discussing so many of these and more intricate systems as well. But the short of this whole story, blood vessel inflammation, blood clotting, vasoconstriction, proliferation, fibrosis, and diabetes or stress hormone outcomes are all possible with the spike protein. Lisa says, why are they not concerned about microclots as much as they used to be with the new variants? Excuse me. I haven't looked at the latest COVID pathologies to see how much of the newer variants are causing vascular damage or not. So I'm not able to comment on it with more knowledge or with an informed background. Lisa says, why only women and not men? So Lisa, we had that discussion. Women have a stronger and rapider, if that is a word, faster, robust and rapid immune system compared to men. So when the spike protein comes and causes the damage, then or the virus causes the damage, their immune system, women's immune system, responds more robustly and rapidly. That, of course, includes the production of inflammation, which causes the damage to their blood vessels. And now, if you said that, why do women have a more robust system? There are so many theories about this, but we know that estrogen causes immune activity, progesterone causes immune suppression. In the fertility time, as the estrogen progesterone keep fluctuating, the immune system goes up, comes down, goes up, comes down. So the immune system is trained differently in women Then during their pregnancy, immune system is made active in a different way. Then after the pregnancy, their autoimmune disease production has a greater propensity because of the various cellular activity, cellular components exposed to the immune system. So their immune system is more active. It is for the baby's protection as well, but then it becomes a difficult one for themselves. This is a very good question. How prevalent is the spike protein in the unvaccinated versus the vaccinated? So, I guess the first question is, how prevalent is the spike protein in general? Do we have, as a population, spike protein in it? So, I feel that those individuals who became infected and recovered and have no further symptoms, or those individuals who were vaccinated and recovered and have no symptoms, they probably don't have spike protein in them. But those who developed long COVID or developed vaccine injury, one group of them has spike proteins uh, present in them as well. Now, this is a very good question, and I do not think I have an answer for this. At the prevalence for this comparison, and you know why this comparison may not have been done, because it is very difficult to try to have studies that are going to discuss vaccine related issues. I hope we can now have the studies, but you know that these studies were not very much encouraged or funded or liked. So because of that, we don't have much data. And it is ironic that because we don't have much data, now whenever scientists discuss these problems, they simply say, look, there is going to be nothing for you to do. There is nothing for you to do because there is no data to support So, as usual, my system has to go down when I'm doing a lecture, especially live. So it froze up, I know, and now I'm back. So this is a very good question by Gambit. Does spike protein pass blood-brain barrier? Could this lead to Alzheimer's in the future, neuro issues? Yeah, I have done this discussion. Yes, spike protein can cause the inflammation of the blood-brain barrier, which would then make it permeable, and then spike protein can enter the blood-brain barrier as well. Secondly, if you remember Dr. Bruce Patterson's work, he said that the monocytes that are present on the inner side of the blood-brain barrier, that is on the neuronal tissue side, these monocytes were holding on to the spike protein pieces in them. So how did spike protein ended up on the inner side of the blood-brain barrier, on the brain side of the blood-brain barrier? So of course, it crossed there, or messenger RNA crossed there, either from the virus or from that, or the virus itself crossed in the brain and then left the spike protein in the monocytes, etc. So can it be there? Yes. Can it cause future Alzheimer's or dementia problems? Yes. You would actually see that a lot of us are already showing neurological symptoms that are of advanced age at younger ages. Just like the blood vessels have become more chronologically aged, I believe brains are in a similar area. Anthony says, what is the risk benefit of current Moderna vax for 73 male? That's a difficult question to answer just based on this statement, because what I do not know is the comorbidities. If there are comorbidities which put a person at risk, especially those kind of comorbidities in which immune system is not responding well. So for example, somebody has HIV, or somebody is taking immunosuppressive drugs, or somebody has cancer and they are taking immunosuppressive drugs, or somebody has um, immune system genetic issues. So in such cases, they may be a very good use of the vaccine. Or if they're so frail that, for example, having the infection may become so intense that they are not able to handle those symptoms, then they can take vaccine to reduce the symptoms. Lisa says, I have autoimmunity and clot easily. That is why COVID spike protein. COVID spike protein for sure has a tendency to mm, cause, blood vessel pathologies, including clotting. Roller Girl says, try lemon in hot water every day. Is that for my cough? I will. My wife keeps trying her own things on me. This started 3, 4 days. Whenever I travel without Cofix, I get this punishment. CMOS to help immunity. Yes, they say the same about neuropathy. Yes. And Heather, neuropathy is actually much more evident. You can actually see people not able to do math correctly or planning correctly or become more anxious and depressed or irritated. It's not necessary that people just changed. One of the reason for the psychological uh, changes is inflammation of the brain. The depression or irritation or agitation is the inflammation of the brain that can cause it too. Absolutely. Yeah. So Anthony says no comorbidities. No comorbidities, no, if good health, no risk that the COVID may, and if they have had COVID in the past and recovered, that is even better. Then they can discuss with the doctor that do I really need to have the vaccine? So, what else is happening? So, this is the discussion. The video before this one is even more important. That is the um, aging of the blood vessels after COVID-19 in women. Really important so that you can see how to help those blood vessels and protect the cardiovascular system. Nidhi says, Nidhi Dhawan, what about the flu vaccine? So, Nidhi, I will assume that you're saying, should we take it or not take it? Same behavior or same set of uh, thinkings or thinking patterns, that who is the person who needs to take it? Have they had flu before without the vaccine? How did that go for them? If they did not have it, if they have comorbidities, if they are at a higher risk, then maybe they should take it to protect themselves from the untowards outcomes. Lisa says, I'll watch the video prior. Thank you very much. That is an important video. I have been coughing in that in this one as well. So my videos always have some sort of a bad thing in them and people don't share them. So if that is the case, there is a link in the description for the video, for the study. So you can just share the link. Lisa says, you have done a lecture on the BBB a month or so ago. Always great. Absolutely. And talking about the blood-brain barrier, when I was producing some lectures for FLCCC, I think I did a 17, 18 lecture series on the near infrared light, mitochondria, and the blood vessel health, especially in the brain, and how the brain garbage collection system works, and how it is important for it to work better because it has not been working very well after COVID and vaccines. And I saw a few days ago, I saw a study that said that scientists, researchers are finding out that the garbage collection system of the brain isn't working correctly in people with COVID-19 or they don't use vaccine. And here is what to do next. So I did that 3, 4 years ago. So they still, I believe FLCCC still has it on their educational material tab. I think there are my lectures still sitting there. In there, you would see that the brain health and sleep and those things and those lectures are there. Roller Girl says, I'm excited to watch. I missed you earlier. Absolutely. I was working on the book My presence actually tells you that majority of the book is done. So with this, so Ibrahim asked a very good question. Is there any supplements or foods that reduce brain inflammation? So generally, there are two ways to approach this. And I'm going to assume that when we are saying brain inflammation, that is because of the inflammation from COVID or spike. Because if you look at brain inflammation, it could be something that is inside the brain. There is an injury in the brain, or there is infection in the brain, or there is a cancer or something else that is in the brain. So that is one possibility. And so doing anything outside would not help that for a very good um, measure. Then there could be brain inflammation because the blood-brain barrier is compromised. So brain is actually fine, but the blood-brain barrier is compromised, and from there the toxic substances are spilling into the brain from the blood circulation. So then we have to look at the blood-brain barrier and try to fix that. Then, if you come out in the body, any infection in the body, any inflammation in the body that produces tumor necrosis factor alpha will cause brain inflammation as well, because tumor necrosis factor alpha crosses the blood-brain barrier, causes the inflammation in the brain. It causes the activation of the brain immune system cells. So that means it's really not a standard generic solution to say, take curcumin and you'll be good. It depends what is the reason. So one can start with reducing the inflammation in the systemic area with curcumins and resveratrols and quercetins and omegas and so on. Then go further to handle the spike protein with spermidins and resveratrol like things. Then go further to handle interleukin 6 and other molecules. Then go further to discuss with your neurologist and immunologist to see if there are blood-brain barrier antibodies that are being produced, and then have antibodies against them. And then, of course, even more invasive method would be CSF analysis and the imaging analysis of the brain to figure out what is happening in the blood-brain barrier and the tissue inside, and then decide what to do with that. So not a simple answer, but there are ways to start figuring this out. Oh, so red light is amazing, Wayne. Near infrared light is like a magic. It can penetrate through the body. It helps the mitochondria. It helps the other parts of the body as well, other tissues. It is a magic. Jim, this is a very interesting question. Anything for the chronic gut dysbiosis? So, of course, always going back to what is causing it. One thing that I always tell my patients, and after so many years of fighting, I got my license from Pakistan. It was sitting there. So I tell my patients in Pakistan, I practice there, that for gut dysbiosis, the very first thing to stop is fried foods, because the fried foods have age and ale in them, advanced glycation end products, and advanced lipoxidation end products, which cause the gut to be more damaged and inflamed, which then causes toxins to be spilling into the blood, and that even the microbiome. That is one. So give it a rest. Aspirin is another. It really helps in men for sure, the gut to start reducing inflammation and allowing the community of microbiome to start reestablishing. Then probiotics are very important. And of course, then worst cases is the fecal transplants. But mostly with these, you would start seeing the results. So Dairy is so Jim, dairy is always the bigger problem. So there are some people who are just completely allergic to dairy products, and dairy would just throw the whole thing off. I mean, I take that as a um, given. Demi says, "Did you talk about nicotinic acid, or nicotine for reducing?" Not yet, not as a separate lecture, but in these kind of talks, nicotine. The very first study that came out, excuse me, for nicotine was from France with COVID. So I have had that discussion as well, but not as a separate lecture. So Joey says ibuprofen to fight inflammation. Yeah, that is fine. I mean, that is one way to fight inflammation. The only thing is, if you cannot take ibuprofen for a very long time because of the GIT issues that it will produce, then you can take other things like curcumin and Nigella sativa, um, omega 3s, etc., omega 6, 3 balancing, and so on. Aspirin, Frederick, to your question. I did a study a few months ago. That study said that aspirin, the 75 milligram, can you imagine, not for blood clotting, but for GIT? Aspirin 75 milligram, that is the small dose, baby aspirin, helps reduce inflammation in the GIT and helps start sealing the GIT cells to reduce inflammation, which then starts healing the remaining parts of the GIT. And not only that, the microbiome in the gut, when it makes weird things, imagine if the microbiome community is not the correct one. So when it makes toxic substances, those substances can enter our circulation through the inflamed gut. Plus, the immune systems are triggered, and they also start making tumor necrosis factor alpha and others. They all go to the brain, and they cause brain inflammation and issues. Aspirin reduces that as well. So aspirin to reduce dementia or acceleration of dementia and improving the gut health. You can actually Google that. I think I have that study on this channel as well. So Jim is talking about augmented NSE. I haven't looked at any recent data. There are people who swear by it. I actually think that generally NSE itself is useful. So with this, thank you everyone for your time. Have a nice weekend. If it is already started, enjoy it. And I would see you next week. If you have any topics that are of interest, please write them down here. I would read the comments and try to do those topics. Heather says 81 milligram. Yeah, that's fine. Aspirin. Bye-bye. You're very welcome, Athena. Quentin, welcome. Demis, welcome. Wayne, welcome. Marsha, welcome. Jithin, Jose, welcome. Frederick, welcome. Heather, welcome. X39 Hector. Aim, welcome. Can you talk about your supplements? Do you talk? Absolutely, I can. Goodbye, doctor. Goodbye, Hector. Love the art and education. Absolutely, Aim. Thank you. Bye-bye. Today's lecture was not very artful, but hopefully it was useful. Bye-bye.